working?
Yep, we can see that just
Okay.
fine. Okay. Fab. So I will go live very soon, right now. Best of luck, everybody.
Thank you.
Glenn, we're all set to start when you'd like. Thank you.
Hi, colleagues.
Glenn, you're on mute.
At last. Sorry, I've had some real problems getting onto the call, so apologies, everybody. How you doing? Nice to meet you, Gareth. Hannah, hi, good to see you. Hi, Fraser.
Good to meet you too.
So apologies, guys. Are we ready to go, Amber?
Yes, we're all ready to
Yeah,
go.
everybody else is ready to go. Okay. What I'll do a very, very quick intro, guys, and then I'll bring you in term as we kind of go through the next short while, and then we'll get into a kind of panel discussion. So if everybody else is ready, then I'm ready to start. Amber.
All good.
Excellent. So good afternoon, everybody. Welcome to I think the final session of the second day of the Impact Forum. Hoping you can all hear me and we can get started for the session. So as you will all hopefully be aware by now, the Centre for Homelessness Impact is an independent organisation that supports the use of data and evidence in bringing about a sustainable end to homelessness. So a little bit about myself. So as both a board member of the centre and a chief housing officer in local government, as well as someone whose education and training lies largely in the field of commissioning, I believe strongly that good decision making should be informed by the very best of available evidence about what works. And of course, as a member of the What Works network, CHI supports organisations across the homelessness sector, not just in the UK, but beyond as well, to make evidence-led decisions and to adopt evidence-led practices to really drive that sustainable change that we've referenced earlier. The theme for the 2021 Impact Forum is that of collective resilience. And today we are exploring the politics of place and how local government and indeed local governments and organisations across the world are responding to rising homelessness. Policymakers are increasingly recognising that community can represent an affinity amongst people, but also an attachment to place. And we'll go on to hear, I think, certainly from my own views, how that is certainly the case in some seaside towns in the UK. People can strongly identify with where they live. So in England, ministers talk about levelling up, and that's a very live conversation at the moment with the Levelling Up Fund first round bidding ending at the closing at the end of this month. And they're talking about spreading prosperity and opportunity more evenly across the country. I guess from a Southend on Sea or a council perspective, we're really keen that that's not just a north-south thing, but also that we are really, we mean what we say when we're talking about levelling up across the different disadvantages that might play out across the country. They also talk about responding to the pandemic and the economic recovery by building back better. And I guess one of the questions that we across the globe all need to consider is how can we ensure that ending homelessness is meaningfully and absolutely embedded within this approach. So alongside me here today are some colleagues from some other coastal communities. Fraser, Hannah and Gareth, and each will speak in turn about their perspectives on this area of thought, and I'll leave each of them to introduce themselves as we proceed. But before we do, I wanted to weigh in with a couple of my own opening thoughts on this, and to pose a few questions that have occupied some thinking, my thinking on this over the years. The topic for today's session is unique challenges in coastal communities. And one of the questions is, do coastal communities need bespoke ways to end homelessness? So I guess as I've thought about this over the years, I've ranged from what we might refer to as barroom psychologist to a reasonably experienced commissioner to the person who sits before you today. And while certainly not an expert, I'm definitely a very interested party. And I guess I've wondered about what I coined the Brighton Rock theory. Where people are attracted to the relative cover that seaside towns might afford them for different ways of living, for itinerant living, if you like, where there are low wage economies very often, and sometimes where there might be low levels of survival techniques, different levels of kind of behaviours and crime and so on, which might go with that, but within which there is lots of seasonality. There are different manifestations of that place in different seasons, and indeed there are winners and losers. I've also wondered about life on the edge, the very idea of liminality, so being at the limits, being at, literally at the margins. I've thought a little bit about the faded splendour of seaside towns and the nature of accommodation that this offers, as well as the fact that sometimes the now fails to live up to the then that people perhaps seek out as they try and find their way back to different times when perhaps things were better. And I have crunched some numbers on this a few times in my career as well, notably when I was a commissioner. And there are some very strong correlations between coastal community or seaside town and some pretty stark statistics. Higher rates of poor health outcomes in coastal communities, higher rates of drug-related deaths in lots of coastal communities, lots of mental ill health in lots of coastal communities, high unemployment, high rates of rough sleeping, and so on. And there are, these are by no means universal, but there are strong correlations. But why? And I guess that's the question that we want to ask. So as commissioners in or policymakers in local areas, what does local government do to try and get ahead of that? What do local providers need to be doing differently to try and kind of arrest the problem, as it were? So at one point in my life, I studied geography, and there was a famous geographer, or is perhaps still, I don't know, I've lost track, a famous geographer called J. Nicholas Entrikin, and he spoke of the importance of studying place, and that getting to know place is essentially both an objective and a subjective pursuit, and it's not just abstract research. So I guess in that light, I'd like to hand over to the first of our guests this afternoon, Fraser, to tell us a little bit of his view on this challenge from where he sits in Bournemouth, and I guess his subjective experience on this, but also some of the kind of more objective observations that he might make on this. So Fraser, if we can, over to you.
Thanks, Glenn, and everyone. Yeah, my name's Fraser Nicholson. And I'm Homelessness Strategy Manager at BCP Council. BCP, for those who don't know, is Bournemouth, Christchurch and Poole. And that it's been one council for about 2 years, just over 2 years, and it covers the three towns in one council. Each town is different and has different elements to it and different a bit of a different feel. But overall, it is one urban area, all on the coast. So, and I've been living down here on this coast. I lived in Christchurch, then I lived in Christchurch, then Bournemouth, and now Poole for about the last 20 years. So, I mean, in this, I've been asked to look at some of the major and unique issues facing coastal cities, what the drivers are for higher levels of homelessness, and maybe think about what some of the patterns are for those experiencing homelessness. So I've talked about that and a few other issues which I've got some thoughts on, which I'll run through. So, I mean, I think first of all, it's fair to say that not all coastal communities are the same, and some are rural, some are urban, some are in the south, some are in the north, and so on. And probably as well as that, different in terms of overall wealth, with emphasis on overall. So that the BCP area is overall quite a wealthy area, which I'll come back to in a minute. The rents are high, with relatively low LHA rates, with very high rent. And there's huge, massive demand. It's, I suppose, viewed upon as a premium area. The blue flag beaches, the history of Christchurch Poole. It's got an airport. It's got easy access to the continent through the ferry. Proximity to Jurassic Coast and the New Forest and all of that type of thing, and the countryside. So it's an urban area with the countryside on its doorstep, and it's a landlord's market. So it's expensive to live here, and that means there's related issues. So for factors such as the need for a guarantor, for example. Now that's not something that would be limited to a coastal area, but in this coastal area, it certainly is an issue. That can be a challenge, and is a challenge for people, younger people, for example, trying to access housing for the first time, and people that are in supported housing, trying to leave supported housing. That's a definite issue, so which then affects the whole system, if you like, in that sense. So yeah, the cost and the demand for accommodation is a driver of homelessness, and affects homelessness. There's also a low proportion, relatively speaking, of social lets. I guess that varies up and down the country as well, but it's something that, relatively speaking, is low here. It's something we're trying to address and get more of, and it's a bit of a priority for the council, but it's still where we're at now compared to the past, compared to even other parts of the country, is very, very low, relatively speaking. And then I mentioned it being a wealthy area overall. That's true, but there's also large disparities. So across BCP, there's areas which are have high deprivation. So it can be perceived as the rich south or whatever, or the rich part of the south. But there's areas within Poole, Christchurch, and Bournemouth. There's areas of deprivation, high deprivation, and then that's contrasted with areas of very high. Areas with very, very high real estate value. You've probably heard of Sandbanks, for example, Barry Redknapp's part of town. That's extremely expensive. I think it's the most expensive real estate in the world. And then, even to give another example, just further the other end of BCP in Christchurch, beach huts. So there's beach huts. There was one in the news quite recently, a beach hut. Well, they're often more expensive than houses, but there was an extreme example of one in Waterford, which is in Christchurch, which was on sale for £325,000. which is more expensive than houses in most parts of the country. And to give specific context, you could get a 5-bedroom house in Rotherham for that. And this is for a beach hut, which, yes, it's part of the beach, but you can't even live in it 12 months of the year. So huge disparities of property value and of wealth as well. Also, second homes, another area, another aspect that can be an issue around different parts of the country. Is an issue here as well. Second homes, many worth a lot of money, yet are empty for a lot of the year. The land, overall, the land is a premium. And again, with the coast, you have anywhere at the coast, you've got a wall which you can't get beyond, called the sea. Can't build on the sea, at least not at the moment. And then behind the conurbation is a lot of green belt. So the land is at a premium within, where the existing land is, if you like. So there's an awful lot of focus on reusing brownfield sites and trying not to impinge on the green belt. But that's a challenge in terms of how much demand there is for accommodation. Kind of touched on this, but limited affordable housing from all means, whether that's certainly through the private rented sector, that's a challenge. Some other through housing associations and so on, there is some, and through the council. And in fact, there's been some announced this week, a couple of schemes which will deliver more affordable housing to the area, which is welcome, but we need more of it. And then something, again, was talking about this in a meeting earlier. I'd heard about this, which I'm not sure about the scale of this here, but I wouldn't be surprised. And that's the rise of Airbnb. As that becomes more popular, obviously that's not local people that are living in those properties, but it's people, tourists and so on, which is fine for the tourist industry, but not necessarily for people trying to get accommodation locally. And then I think, as Glenn touched on, there's a large service sector in the area, lots of bars, restaurants, all that type of thing. The gig economy. So that's that, and there's a seasonal aspect to that for sure. Obviously in the summer it's booming, not so much the rest of the year, maybe at Christmas as well, but it's very seasonal. And of course, during COVID, a lot of people have been on furlough. That's coming to an end, and so that there's potential implications around that, which we're having to be very mindful of. And then I'm trying to watch my time. I think I'm a couple of minutes. So just a couple of additional factors in terms of rough sleeping specifically. The southern climate is good, comparatively, and that can be a draw for people because it's generally warmer, it's generally drier, it's a mild climate, so that can be a draw to people. The relative wealth of the area can be a draw. If people, sometimes we get people that are coming, they're coming in to sort of take advantage of the fact that there's a lot of tourists in town, and that might mean that they can beg and things like that. There's one thing that we're very conscious of is not to conflate that with rough sleeping, because that's not all, it certainly isn't always the case. But there is some evidence that certainly during those spells, rough sleeping goes up, including from people that are not in the area. And even the fact that it's at the end of a mainline train route, I don't know how relevant that is, but I've heard that discussed before here and elsewhere. That it's a natural place to get off if you're coming from the north or coming from London even. So yeah, that's just a flavour really of some of the factors into homelessness, some of the challenges, some of which we have plans in place to address, and some of which are more market forces which are harder to address. Thanks.
Thank you, Fraser. Some really interesting thoughts there, and we'll go to Gareth in a second. There are some huge similarities between some of what you've said. I mean, we can't. I'm pleased to say compete with the value of beach huts in Southend, but some of those disparities that you've spoken of in terms of relative wealth, end of the train line, numbers of second homes, etc., are and the gig economy stuff that I touched on already are absolutely features that I've seen in Southend and elsewhere. And speaking to colleagues in other parts of the country about this as well, they seem to be features. What we do about those are the harder questions, and of course they pose questions for us from a not just a local government provider perspective, but from a third sector, faith sector provider perspective as well. So, Gareth, if I can hand over to you now. We also have a YMCA in Southend, and I guess the one of the facts about Southend YMCA is it's been here for over 100 years, which would suggest that actually this isn't a new challenge in lots of ways. This is something which has perhaps been a feature of coastal living for quite a while. So from your perspective, what are the challenges that you observe on a kind of day-to-day, week-to-week, season-to-season, if you will, basis? And what are some of the questions that you want policymakers to help you address in terms of how we move beyond it?
So yeah, that's a great question. Down in Bournemouth, where we are, we work across Bournemouth Pool, Christchurch, and into Dorset. But the predominant work that we have targeting homelessness and supporting vulnerable adults is in the Bournemouth area. We have a facility which is right by the pier, right near the beachfront, which has a drop-in facility on the front end so that we can meet the needs of people that are straight on the street and help signpost them. But we also house people in that facility as well, and we provide high levels of support for people with complex issues and complex needs. So that gives you a kind of framework of where I'm talking from. For me personally, I've worked all over the country. I've been in the YMCA for about 3 years, and I'm networked across YMCAs nationally. And certainly the features that you've identified of coastal challenge are something that we see replicated up and down the country. Along the coasts, you tend to see higher rates of substance misuse issues, life controlling issues, certainly higher rates of mental health problems. And what we end up seeing on a frontline basis is very troubled, complex individuals that carry with them a variety of different challenges. That some of them have been a cause of them finding themselves on the street, and some of them have happened as a consequence of them finding themselves on the street. And sometimes it's very difficult to discern between the two. And the result is that when it comes to the challenges that we face as service providers, one of the primary challenges, which is always the thing everybody talks about, is how do you fund adequately the demand that you see in front of you? And certainly in the last 8 years of delivery in the area, and we've been in the area for 140, so it gives you an idea of how long we've been down here. I think we predate the council, ironically, so there you go. The challenges are that there's been a decline or a stasis of funding to deliver support to individuals in the area. I think it hasn't changed in 8 years. And of course, national living wage has gone up, and we pay our people appropriately. So you have to deliver on a shoestring. And I think part of the challenge is that the individuals that we're looking after are becoming more complex, not less. And the service that we're offering has to become smarter every day. We offer trauma-informed, psychologically informed environment support for individuals, and we have a very good track record for turning lives around. But that's often at the expense of the morale, the pressures on staff teams. And certainly COVID-19 has significantly impacted our ability not only to run our service, but also look after our staff adequately and properly. So Bournemouth is a little bit like Blackpool. It's one of the hotspots for heroin misuse. So we will regularly be looking after people with complex mental health and substance abuse problems with the Class A substance misuse issue. And so the challenges that we face are balancing the funding, the support needs, and making sure that we have a person-centered approach to help turn people's lives around and get them to a place where they're able to live independently and think about the future. So creating a safe, high-trust environment, these are the things that we focus on. Create a nurturing environment that has a strength-based approach to people's lives, turning their lives around, and then getting them to a place where they can move on successfully and have meaningful occupation. Because of course, without the latter, which is the hope and purpose and meaning that you give people in life, their ability to engage with turning their lives around is challenging. And that is where I think coastal communities are really struggling to offer meaningful occupation work that's sustainable, because we have transient populations, we have gig economies, we have tourism economies, which are notoriously unstable in their work offerings. But we also have the challenge of creating the move-on accommodations that are sufficiently nice, that aren't, HMO packed full old Victorian properties that are run down. And of course, with the challenge now of COVID-19 increasing land values in the areas of coastal communities, people buying second homes and properties and wanting to do them up and have their holidays and all those sorts of things, which are all brilliant because they help bring economy to the coast. The knock-on effect is that the rent's available for individuals that we look after. So when we get their life turned around and we want to help them into the next step, the rent's available means that they're on the bottom rung of the ladder with the quality of the properties, which is more likely to kick them back through to a place of stress and therefore a place of breakdown than if we were to be able to give them something which is a better provision. We're a registered provider. We want to develop, but our ability to acquire properties, to then redevelop those properties, to then give people that move-on accommodation is challenging. The bureaucratic system is slow, and so we can't compete with a developer that will come down and just slap cash down. And so therefore we compete for the lower value properties, which then make it more difficult to create a psychologically informed environment for the individuals that we want to house. So there is a vicious cycle that is going on, and I think it's being compounded currently because the land values are going up. I think Cornwall's gone up 10% in the space of 6 months. So the ability to acquire, to redevelop. And the other issue that I can see is that coastal communities, you can't draw a circle around the town centre and say, let's redevelop in that area. You can only draw a semicircle around. And like the chap from Brighton has identified, there's greenbelt issues and conservation areas that you can't smack into. A lot of government funding at the moment for development of move-on accommodation is asking for new move-on accommodation. And yet a lot of the accommodation that's currently provided in coastal communities is HMO. Certainly there's a huge amount of private HMO lets that are going out. It's lower end of the market, which means the accommodation is not good. And really, there's a regeneration approach that needs to be taken to coastal communities, not just new builds on land that hasn't been built on before. And in order to do that, we need to have conversations with the kind of decision makers that are commissioning in government to say that the money needs to be targeted not just towards new and provision of new spaces in housing, which is needed to create affordable accommodation, but we also need to be targeting regeneration of some of the coastal community areas because you can't expand anymore. And so there has to be the ability to acquire capital to be able to regenerate and put in the new. Last but not least, because you wanted me to cover collaborative work, clearly homelessness is a complex problem. I'm fortunate enough to be part of a team in BCP where we have an awful lot of collaboration that takes place. We know a lot of what the community is doing, a lot of different service provisions that go on. There's a high level of network connection. The next step for that is what you're talking about with data, is how do we collect the same data? So we're comparing like for like variables when we're looking at the impact the services are having, and how do we fuel those that are having better impacts? Likewise, when we look nationally, and I'm thinking about the YMCA and broader, how are we collecting the information on the quality of our services so we compare like for like when we look at the data that's coming out to say who's more effective than in their service than another? And so that's where the shared understanding of data collection, shared understanding of mutual work and like for like, needs to take place, because otherwise we're comparing apples with pears, and you can't draw out from the data the evidence-based approach that you would want to have to say what's the most effective thing we can do. I've been as quick as I possibly could. I'm supposed to finish right now, so I'll stop.
Gareth, thank you so much. That's fantastic, and again, some really key points there, which I see some colleagues are chiming with in the chat. The data point is a really interesting one. What's the objective? What are the data points that we need to be collecting in order to kind of measure how well we're doing against those objectives? What does the research evidence tell us in terms of the best routes towards those objectives? I think the points about land values are also really interesting ones. And the last one, the last 12, 18 months or so has shifted that considerably. I think the data I saw last week was that nationally, prices have gone up about 9%. So it's not just Cornwall, unfortunately, as a very desirable location. Lots of other coastal communities, as yourself and Fraser have touched upon, have also been impacted by that. And perhaps some cities are seeing a decline. I haven't looked at the data closely. Certainly from the work that we do in Southend, we are finding it harder to buy properties in our acquisitions program than we were, say, a year, 18 months, 2 years ago, because they're flying off the shelves. Apart from anything else, we can't move that quickly, but also the price is exceeding the values that we're able to purchase at. And we are all, whether we are third sector or local government, governed by certain requirements. So you're right, there needs to be a conversation, I think, centrally with policymakers about kind of a regeneration master plan, if you will, rather than just thinking about HMOs and, heaven forbid, but somebody's got to mention it, permitted development and office block conversions, which is the other thing which I think is a challenge for lots, not just seaside towns, but lots of towns and cities up and down the country, where we are depositing people into substandard accommodation, which is in turn leaving some people's lives in misery. So thank you, Gareth, for your views. We'll come back to you very soon. Hannah, can I invite you to give your perspective on live from Scarborough, and over to you.
Of course, yeah. I'm going to come at this from a slightly different angle. I'm going to start by saying I am in a camper van, and I've done that for a very specific reason. It's to emphasise some of the points I'm going to make. So Scarborough's a small, it's a fairly small town, and I'm going to come at this from a young person's perspective as well. So one of the main problems with Scarborough is the limited opportunities for young people. Long-term employment, it's mainly seasonal jobs. I think one of the things I've noticed is that problems with the wider system, with the wider homelessness system, are perhaps exacerbated by the fact that it's a small coastal community. So the lack of temporary accommodation, the lack of emergency accommodation, things like sofa surfing and hidden homelessness, especially amongst young people in Scarborough, is a massive problem. One of the problems, I guess, with the system is, locally at least, you've got to meet criteria, they've got to tick certain boxes, and that can be really problematic. And I think one of the questions, the theme for the week is resilience, which I think is a great word, collective resilience. But I think we need to be asking the question of who should have to be resilient. I shouldn't have had to be resilient when I was homeless. Like, the system should have been designed in a way that got me out of that quickly, and it wasn't. So one of the something I'm going to highlight is choices and connections. So I talk about this a lot when I talk about homelessness, and when for me, part of my story is I've experienced a lot of trauma, and just realized I didn't actually introduce myself. So I've written a book about my experiences, which if you want to know more about them, you can grab a copy. But when you've experienced trauma, and we know that homelessness can be both cause and effect of trauma, choice and connections are things you don't have. And the homelessness system can make that worse. And it can be, I guess, triggering if you've experienced trauma. So I was put in a hostel with 19 other young people, all under the age of 25. And that was, I guess, it highlighted for me the fact that that wasn't an environment that any of us were ever going to improve our lives in. Like, you can't put 19 young people in a hostel and, there's drugs, there's people experience trauma, there's mental health. And, I don't know who thinks that is an environment where people are then able to improve their lives. So something else I talk about, and I guess I'll go back to that actually. So the choice and the control thing, when people, when you're given choice and when you're given control, it allows you to take part of your life back. So I think when you are forced into accommodation or situations that are out of your control, it makes things worse. And for me, it made me want to disengage, and I would have been labeled as hard to reach or whatever, when actually I was being put in situations that were triggering for me. So I think there's questions there around, because it was a small town, there wasn't gender specific services, which was a massive problem. But also this word trauma informed, I think a few people have mentioned it already. A lot of people call themselves trauma informed, and that's great. But in practice, at least here in Scarborough, I didn't see that. If you went to the charities now, they would say, yeah, we're trauma informed, but actually they're not at all. So why am I sat in a van? Because, to emphasize the point about choice and control, I have a choice over what I can do and when I can do it. And that has had a huge impact on my well-being. Another huge part of my story is surfing in the sea. As part of my book. And I think there's something to be said, like a lot of people in Scarborough, at least, they moan that people come to Scarborough when they get out of prison, or they find themselves going through a tough time and they come to Scarborough. But actually, like, I think that's because there's something in the sea. For me, the sea was a massive healing force. And I think that we should be utilising that. Services within Scarborough should be utilising that. And I guess services in other places should be utilising whatever resources they have. And I think a massive thing is two more massive things. Just shout at me, Glyn, if I've gone over my time. The surfing thing links into having fun, and I get, we're all adults, we've got to work, we've got to pay bills and etc. But when you're experiencing homelessness, just having something fun in your day or in your week, in between you going to the job centre and then the housing office and then the library or wherever else you've got to go, mental health services, having something fun within your week can actually really make a big difference. And I think as adults, we don't, we almost have to give ourselves permission to have fun, and it shouldn't be like that. And then my final point is around, again, the system and services. And I mentioned that you've got to almost meet certain criteria to access services, and they'll put you in boxes, and they'll give you all these labels, complex needs, hard to reach, hard to engage, dual diagnosis. Like, there's so many labels that you're given, and half the time it's probably due to funding and different things. But actually, like, if you keep telling someone they've got complex needs or that they're hard to reach, they're going to start to believe it, and it's going to affect their well-being and how they see themselves. So I guess my point here is about just treating people like humans. Obviously, got my t-shirt on, treating people, like people that have experienced homelessness or people that are still experiencing homelessness are no different to anyone else. We just happen to have gone through something, or something has happened in our lives that has meant we have ended up with nowhere to live. And I think yeah, I've probably gone on a massive tangent there, Glenn. I apologise. But my last point, so I've written the things that I needed when I was experiencing homelessness, things that I've got now that I didn't have then that I really needed. And I think this is big in Scarborough. So I'm part of various different communities. There's a massive online community called Camarados, which the t-shirt is from, but it's about connecting with people and getting alongside other people that are going through tough times, but without the intention of trying to fix people, because services do that. Services try and fix you, and sometimes you've just got to sit alongside someone, and most of the time people have their own answers and people know what they need, and you know, if we're given space, we can work that out for ourselves. Yeah, and I think in Scarborough especially, there's a real like small town mentality. There's not much community at all. People don't really come together, which is disappointing. But yeah, I think that if we had more of a community feel, that would probably help with prevention. Yeah.
Thank you so much, Hannah, and please don't apologise. And firstly, you haven't gone on. You're well within time. We're good. But some really important points there. So without me paraphrasing those, I'm just going to kind of dive into some of the points that you've raised and frame those as questions to us all. And I see that some more's appeared in the chat, so I'll try and review those as we speak. But the whole idea around labels and trauma-informed environment, psychologically informed environment, my background is in drug and alcohol services, commissioning drug and alcohol services in particular, and there's lots of evidence around things like motivational enhancement therapy in the States, really longitudinal studies, and it's based on, you know, people doing extensive training and delivering things in a particular way. And then we import it to the UK and we send somebody on a day's training course or a 2-day training course, or if you're lucky, a 4-day training course. And then we point them at some really vulnerable people with some sort of complex trauma and say, right, you're now a motivational interviewer, on you go. And we expect things to miraculously kind of change for that person for the good and sustainably so. So there's something about how we deploy the evidence, which I think is kind of fundamental to some of this. So Hannah, if I can come to you in the first instance, I'd be really interested to kind of sort of dig into your observation there a little bit more in terms of, I guess, the shorthand usage of some really important terms, and how does the fact that we call something PI or trauma informed or you know, X, Y, or Z get in the way of the impact, but also coming back to your other point, does it in a way label what it is that we are seeking to achieve as well?
I think it's important to be trauma informed, but that should be the default, in my opinion. So trauma impacts everything. It impacts housing, it impacts benefits, it impacts your mental well-being, it impacts education and schools. So it should just be a default. So I think for me, when I've had experiences of trauma, I should have been able to access single-sex accommodation, and I should have had support to sustain that. Being forced to live in situations that weren't single-sex was really not, at the time I never thought about it. Now it makes me furious, you can probably tell. But yeah, I think, you know, if you're going to say you're trauma informed, then there has to be single-sex accommodation, there has to be single-sex staff, or, you know, like if you're working with a female, you have a female member of staff, if that's what the person wants. You've got to give people choices, and you've got to give people control over their own situation. Yeah, I'm not sure if that's answered your question, to be honest.
No, it's really helpful. And Gareth, if I can come to you from a kind of provider perspective, as it were, any thoughts in terms of kind of what we provide, what we call it, how we support our staff to be it? And you talked in your presentation about or again, to use a label, I apologise, but what we might refer to as vicarious trauma amongst your staff. So staff dealing with some really challenging situations, perhaps under-resourced, not having the time, not being able to get the clinical supervision and everything that goes with that. How do we package it all up in such a way that everybody's safe within this? So coming back to Hannah's point in terms of the client needs, if you will. But I think what you pointed to is it's rounder than that.
Yeah, it is much rounder than that, and Hannah's dead right. I think there's a psychological difference when you're providing support between seeing somebody as a person with needs and seeing somebody as a person. It's a little bit like my background's hospital medicine, going up to the person who's going to have an operation that morning, and they're the leg, rather than they're Mrs. Jones. And when you see them as a person, it is a completely different approach than when you see them as a need. And I think what Hannah's experienced is an approach which is needs focused, which is this is another person with these needs, and we need to put them through some sort of cookie cutter, and it dehumanizes it, rather than an approach which is a personal approach, which gives her choice within the boundaries of what can be provided, and gives her options, and is focused on her as an individual. And I think that's where it becomes challenging when you're running in an operation where there is a lack of resources, because what you get with a lack of resources as a provider is you get what begins to happen is you switch from, and this is what happens in homelessness, you switch from being somebody that's resourced and is able to make decisions and choices and to be flexible, to suddenly going into survival mode as an organization, where you're trying to keep things running based on the small amount that you've got, and you're having to make, as best you can, some difficult decisions about where you can allocate your resources and your time and your staff. I'm fortunate enough to be running an operation where we're not wholly dependent on funding from commission services. So we run our own in-house counselling service. So all of our staff have availability for counselling, and that same counselling service runs for all of our residents that we look after as well, so that there is individual counselling that is offered for each one. We can also run physical development services, personal training, because of the leisure services that we run. So we've got that as a cohort. And we even maintained our clinical supervision work even during COVID-19, where it's been particularly challenging to do. But as I've said, there's only so much you can do. And even with all of that extra support that we're providing, we're beginning to see the cracks appear. COVID-19, at one point, my staff numbers were down 40% because of self-isolating or having to go because of clinically vulnerable or whatever it may be. And so the stress and strain on staff was high. I would say that we're probably at the point where we can start to see, like the NHS are experiencing, the kind of the longer term effect of that, and having to work through that. And COVID-19 has created that framework of great challenge, both on individuals and as staff, as organizations. But hearing Hannah, I think properly done trauma-informed services. So we run children's centres, so we're trying to prevent children from having adverse childhood events so that they never end up on the street in 20 years' time. That framework of knowledge, properly done, trauma-informed, is the right approach. But I think it needs to be combined with a strength approach, which is an individual, person-centred, led approach to their development and their support. So that you're giving them freedom, dignity, and choice on the front end to be part of their solution and part of their development. Otherwise, it's a needs-focused approach where all I'm seeing is a person with needs and next mentality. And we need to get rid of that as a culture, not only as organizations.
Thanks, Gareth. And that's a neat segue to where I was going next. And I see an observation made by a former colleague of mine from Southend, Phil, who notes the kind of relative gains of the more human approach of sitting next to somebody and talking to them outside McDonald's rather than waiting for them to come to the Civic Centre as a need, as a widget, as a number in the system, and what we might be able to do with or for somebody in that regard. So Fraser, from a local government perspective, how do we take on that challenge that has rightly been thrown towards the system, if you will, and you and I are both part of the system, and we both have conversations, I'm sure, with MHCLG, as I know Phil still does in his role, and others on the call will also, whereby some of what is required is governed by some numbers, and some of those numbers have got pound signs in front of them, and so on and so forth. How do we humanize it all such that we are seeing people and we are responding to the conversation that we should be having with people, such that we are jointly moving towards better, more sustainable outcomes for those people?
Okay, I mean, it's a big challenge. I think one thing that would certainly help is, I mean, if you think back, Gareth's talked about the fact that services have had reductions over the years, either actual reductions or no rise, meaning an effective real terms reduction. And so that fundamentally was down to, well, the SP reduction, and the removal of the ring fence and all of that stuff. And that's never really been replaced. What we found through the RSI, the Rough Sleeper Initiative funding, is an element of that being replaced, but on 1 year at a time basis, which doesn't help really. I mean, it doesn't help at all, but it doesn't help as well as if it was, well, if first of all, if local government was properly funded, or if the settlements were 3 or 4 years at a time. I know from a lot of webinars that I've been on over the last year, that's a consistent call to MHCLG, and one that I think they're open to. So that, how that would help in a way is instead of a kind of reactive commissioning or mobilisation of services or anything else, it would allow longer term planning and longer term staffing. I think all of this, I agree with I think Hannah's touched on this really, but you can't just label something as strength based and it becomes strength based even, or having a few days training. It's a culture change, and it has to be bought into first of all by staff teams and organisations before it'll even be effective, and that does take time. But if it is bought into, then it will work much better, and people will be doing it for the right reasons and not because they've been told in a training course that they have to do things in a certain way or ask certain questions in a certain way, and it'll be because at the end of the day, people are not, they can see through that. They know what's real, and if you're not real, then you don't really deserve to be listened to in that sense. So I think going round in circles a little bit, but I think longer term funding or properly fund, being able to properly fund services would help, and it would also mean one of the things Hannah talked about as well was about having specific needs of specific services. So having female only, for example, or however that looked. Now, but one of the things that tended to happen with the SP reduction is that services became more generic. It became, single homeless, for example, because there was less funding, so there was less diversity of type of service, and it would help if that could be turned around as well.
Thanks, Fraser, and you weren't going around in circles, and it was a pretty big question that I kind of posed you, so and entirely appropriate responses. And I think within what you alluded to there, one of the challenges is we are, as local government, responding to numbers, as I said, so a bit more autonomy, a bit more kind of longer term surety for local government to commission within. And I know a colleague on the chat has pointed to the fact that the voluntary sector don't have boxes to tick and time limits, so they can be more open to individuals and assist and support them as they want. My observation would be that that's not always the case, actually, and sometimes the way that services are commissioned in the voluntary sector, puts just as many, pushes as many time constraints or numbers onto them as well. So a bit more space for us all to operate in might allow us, with the kind of additional ingredient of better evidence, to get around what we need to do differently. But on that note, Hannah, if I can come back to you. So from your experiences of the homelessness system, as it were, if we can call it a system, it's not always very systematic, but the homelessness sector, what would you do to change it?
What a question. The first thing I'd do is get rid of this need to label people and put people in boxes and tick boxes. And I know there's a question in the chat about the term complex needs, and when people, each service, each system is designed to help with mental health or addiction or homelessness, like one thing. And when a person doesn't fit into that one service or that one system, they're labeled as having complex needs, when actually it's the system that's not designed in a way that will help them. And we know that trauma can lead to addiction, can lead to mental health problems, can lead to homelessness. And it should be all one interlinked system. It should be a more complex system rather than labeling a person with complex needs. I could go on about that for hours. But the same with hard to reach. People aren't hard to reach, services are hard to access. But there's so many other examples of the language that I could pick apart, but I think that's where we've got to start. And just, if we start by treating people like people rather than this like them and us attitude, I think we'd get a long way.
Same question, Gareth. If there's something that one thing perhaps that you could change from your perspective within the homelessness sector or field, what might it be? And we've heard from Hannah, I think the language point is a really important one.
Gosh, what a question. Homelessness is such a complex problem. I think for me, one of the big solutions is to prevention rather than cure. Coming from my medical background, the most cost-effective solutions in all of medical management is prevention. You can spend times the amount treating the problem, and you can spend 10 times less if you just prevent the problem in the first place. And I think listening to Hannah's story, early intervention would have saved Hannah an awful lot of problems. And the same can be said for almost every one of our residents. And it is the reason why we do a kind of across the brief, trying to support families, children, pre-birth, connect mothers with children, and make sure that we minimize the adverse events that people experience in their childhood and running into their teen years. And so, for me, we underfund dramatically these areas as a nation. And if we're not going to set ourselves up for the same problems in 20 years' time, we need to really adequately address and support both the engagement of the volunteer sector, that volunteer time goes in, but also the amount of attention to detail that is needed to adequately provide for children and young people developing in our country to prevent the next generation of homelessness.
Thank you, Gareth. Fraser, what questions coming to you?
Yeah, and I'm third, so it's harder each time to answer. No, I mean, obviously I agree with everything that Hannah and Gareth have said. Prevention, obviously, it's a part of our local strategy for reducing and ultimately ending homelessness. I think, talking of ending homelessness, I think culture and system change. It was just quite maybe it's a bit vague, but we need to properly act as if we are going to end homelessness. And if there was no homelessness in a year's time, there would be an awful lot of organisations and parts of the councils and that would no longer have work. Now that's ultimately what we're working towards, but sometimes you wonder how much not how much motivation is there for that to happen, but do we really believe it can happen? Do we really believe we can end it? I think we need to, if we're going to, we need to think really big. We've seen what can happen with everyone in. Now, the danger with that could be that it reverses, and that would be such a waste. All that resource, all that time, all the good work that has been done with people. So, yeah, I think we have to think big and then follow through on that as a sector.
That's brilliant. That's a great take home for everybody. I think we do need to think big, we need to be bold, and we need to act with purpose. I think is something for us all to gather around. The centre, as many of you will know, recognises that there will always be some episodes of homelessness, but where there are, the aim would be that they would be brief and non-recurrent. And I think we've heard today from Fraser, from Gareth, and from Hannah some different perspectives on how we can kind of take some strides towards that, along with the deployment of good evidence, and really, really, really importantly, how we then use that evidence. So it's all well and good that we've got a load of data, that we've got a load of knowledge, but if we don't know how to then use that in the work that we do, in the experiences that we bring to bear, then it won't be as effective. So we all, I would ask, need to make a commitment to really using that evidence and working with colleagues on this call and elsewhere and with each other to learn together around that, and to kind of really share those experiences, and to be open-eared to others' experiences as well, and be part of that conversation. So it falls to me to thank everybody for attending today, in particular to thank Hannah, Gareth and Fraser and colleagues from the Centre for setting up the call and for being part of today's conversations. For those of you who are able to be part of the rest of the Impact Forum across the week, I hope you enjoy it. I hope there's lots of take-homes there as well. I hope today's session has been good, and I am very grateful for spending the last hour or so with you in your company. Take care, everybody.